Hello everyone, welcome to NetV, the Vietnamese English television. Today we have very special guest, Supervisor Cortese with us today, and in a moment we're going to share a lot of stuff about the health assessment that's been going on right now. But first of all, let me give Mr. Cortese a chance to say hi to the audience.
Hi, I'm very happy to be here. What a great program that this has become, and an opportunity for people to get information like we're going to provide today.
Great. I know that due to your busy schedule, and you put every effort to be here with us today, and I just want to take this moment to say thank you so much for being here with us, and hopefully we're going to have a good conversation.
Thank you. I'm sure we will.
Okay. My first question is, what is the role of the supervisor?
That's a great question, and it comes up all the time, whether it's older people or kids that we talk to in the schools. And one of the things that people should remember is that we have both county government and city government, no matter where you live in any of the 15 cities here, ranging from Palo Alto to Gilroy, Morgan Hill, Milpitas, or of course San Jose, which is by far the biggest city in the county. But all of the people in all of those cities have some services they receive from the city, but they also have services they receive from the county. For example, the county controls most of the library system, the public library system in the county. The cities have some of their own. The county has by far the largest amount of acreage in parks for people. We have a health and hospital system that's one of the largest in Northern California, and it's public, as many people are aware. The hospital system of the county and the healthcare system alone has over 7,000 employees, more employees and a bigger budget than the entire city of San Jose, just in the hospital system of the county alone. The county has the court system, the juvenile justice system, the jails, 2 jails. So all of that is part of the county. The sheriff's department, when you see the deputies driving around certain parts of the city or the outskirts, that's all county. But what's important for people to remember, and we really try to emphasize this with young people, when you go into the store and you buy something, you know, even if it's just some paper and a pencil, you're paying sales tax. And when you pay that sales tax, a portion of it goes to county government, city government, county government, and state government. And so it really is a portion of government that people should use, they should take advantage of. And I always tell people, call us. You know, our number in the office is 299-5030.
Okay.
And call us if you're not sure. You know, people can't memorize, is this city, is it state, is it federal? They don't know if they have an immigration problem or a problem with their street or their street light. They don't know if it's city or county or state or federal. And my advice is call us. Let us make the connection for you. We have great staff people. They'll make the connection from my office to wherever you need to be connected, whatever agency. And from there, we'll follow through and make sure they're taking care of you.
Wow.
And I think that's one of the greatest services county government can provide.
So one of the numbers that we should remember is 299-5030.
That's right. And
that's simple like that.
And today we're going to be talking about a special project that we've done, and people can feel free to call that number if they want to find out more information about this health assessment we're going to talk about.
Since you mentioned about the very special project that's going on since June 2011, I'm going to ask you about the health needs assessment. My question is why you want to choose the Vietnamese community to start with the health needs assessment?
Well, I've had a long and productive relationship with the Vietnamese community here, even before I was a public servant. When I was in private business full-time, one of my first partners was a Vietnamese immigrant who wanted to be, you know, involved in the service station business, and I happened to be in that business among other things. And I learned a lot about the tenacity and persistence and hard work of most Vietnamese Americans who are here through those first early relationships. It reminded me a lot of my own background because my grandfather came here by himself from an island, Sicily, when he was 13 years old, and had to start, from nothing. So I know what it's like for people to have to do that because my own family started that way in this very same area. But one of the things I found out after I got elected, and it really started at the city, as I went to health fairs and some of the organizations that are already trying to do health assessments, I found out that local government hadn't really done anything. About 12 years ago, the county did a health assessment, but it was multi-ethnic, and there's nothing wrong with that. I believe in that kind of diversity. But when you're doing a health assessment, there are certain kinds of things that you find higher propensity of, a higher frequency in certain ethnic groups or among certain populations. And every time I went to a health fair or I talked to doctors from University of San Francisco or the University of California, they would say, we need better documentation of what we know already exists. There are certain types of cancer, there are certain types of health risks that we see in much greater numbers in the Vietnamese community. We want to educate people, but we want to do more than that. We want to get grant money. We want to put more resources into those higher risk areas, those high risk areas, and so that people can have good health. So I vowed a few years ago when I was still at the city, when I was vice mayor, I said, we're going to figure out a way to pay for a health assessment. It wasn't until 2 years later when I got to the county and I was able to work with the county's public health department that we were able to launch this effort.
Due to our budget cut, do you think there's going to have any issue for you to put in effort to do the health assessment right now?
Well, the good news is my colleagues on the Board of Supervisors, there's 5 of us, so we need 3 votes to pass anything. Fortunately, we had the votes to appropriate the money in last year's budget, so this health assessment is already paid for. In fact, most of the work is already complete.
Wow.
There were over 800 professional surveys done. We did use some money to pay for specialists who know how to contact people by phone. But I told the public health department that I know in most communities, including the Vietnamese community, when you start asking people questions that borderline on their privacy, that have to do with personal health, they don't usually like to talk about it on the phone. So it's better to try to convene with people face to face so there's a level of trust there. So another 800 surveys were done by personal contact, and about 150 surveys were done with youth. And these surveys, ask a lot of questions about what kind of health experiences people are having, good and bad. Not just with their personal health, but what is it like for them to try to navigate the system, to get in and out of a hospital system. For example, we have over 250,000 people in this county still who have no health insurance at all.
Exactly. That is the huge number.
We knew before we started the survey that a large percentage must be Vietnamese. But when you do the survey, you can document that. And it makes it much easier to go to the state or federal government or foundations that are trying to steer money into these health issues. And we can say, now we have the assessment, now we have the documentation, show us the money. We need to put some more resources into this problem.
When you say that when you try to do in the survey, of course, like Asian in generally and Vietnamese community, they really don't want to talk about it because due to their personal health issue. What kind of method that you have to use to do in this survey?
A lot of face-to-face contact, and we're very grateful for 2 particular kinds of organizations in this community. Vietnamese media, and for example, this interview is the kind of help that we've been getting all along to get the word out, so people know this is a good thing, it's an important thing, and it's going to be productive. The other type of organization would be nonprofit organizations. Even though there was only one nonprofit that was actually under contract, many nonprofits in this community came forward, many of them that are predominantly Vietnamese, and they said, we will help you convene people, we will help you assemble people, we will help you get the word out, and we'll make sure that people understand that it's safe to talk about these issues with the county government. So that's been a tremendous help. I would say just those two organizations alone, those two types of organizations, have been the most important thing with this whole process.
Okay. Besides your organization, your offices, they have like other departments involved in this project?
Yeah, so my office has really been involved in trying to guide the direction of how this would work. For example, we made the case in my office very strongly that this personal contact needs to be made, and the local organizations need to be used. But really, the key work, what we would call clinical work, is being done by the county's public health department. And that's different than the hospital. A lot of people know we have Valley Medical Center, but the public health department, even though it has a relationship to Valley Medical Center, is an independent department that really focuses on doing this kind of work. That's the same department that if there was some kind of an epidemic of flu or something like that, and you hear about that through the media, usually it's coming from the county's public health department. So we were very fortunate to have them basically devote their staff resources intensely to this project. And I think that says a lot about their concern about the Vietnamese community too. They took this seriously, and they said, it's a large population, over 100,000 in our county. We need to address this, and this is going to help us do our jobs better in the future.
Now, when you start out with this project, you know, you're starting out with the Vietnamese community, but in the long run, in the future, are you having any concern about the other community too?
Yes, and that's the idea. In fact, the public health department, you know, they call this kind of work, they have a big name for it, epidemiology, right? That's the scientific name.
Okay.
But when they talk to us about the budget, they tell us, you know, we want money in the budget to some extent every year now. We like this idea, but we need to do the same kind of thing with the Latino community. We probably need to do the same kind of thing with the Indo-American community, probably other segments of the Asian community. You know, the health risks that you see in the Vietnamese community aren't necessarily the same that you would see in the mainland Chinese American community, for example. The Latino community has a much higher incidence of diabetes than a lot of other communities. Well, there's been some documentation of that, of course, but what other issues exist, and what can we document? So I would like to say that one thing I love about this community of late, when I say this community, I mean the diverse community, the multicultural community here in Santa Clara County, is there hasn't been a lot of any criticism really from other ethnic groups saying, well, why are you doing this with the Vietnamese community first? There's patience, there's understanding, and they understand there's a commitment by the county, you know, to keep doing this and get to everyone. And you know, that's good to see.
Okay, I know that by doing this kind of project, you're gonna need help. You need a lot of support of our community, our non-profit organization, and especially the media. So far in this moment, have you got on-call support too?
We've had a lot of support, but we need more.
Okay, and my final question is, I know that you are one of the public figures that been well known to our community. In the past, you've been done a lot to our community to try to find out, you know, what are people interested on and what kind of, you know, the processing that we can take in order to improve the community. Besides this health needs assessment, do you have other future projects that you're going to working on?
We do, and you know, there's a long list always of expectations that people have, and always, you know, a limited amount of resources. But I've tried to pride myself as an elected official, and even as a private businessman, in always having a can-do attitude. You know, nothing bothers me more than sitting down with another public official, sometimes in an interview like this, and having the other person say, we can't, you know, we have no resources. So I've tried to continue advancing, you know, the community and these causes, even in difficult times. Just recently, an idea was resurrected to do a Vietnam War memorial here, a monument here. And there are lots of community members who are willing to fund that. It doesn't require a lot of public money. It requires public cooperation so that we have the right location. And maybe that's going to be a city or county piece of ground, you know, or a street or an expressway or something. But we need to get the community behind it because, you know, lots of small donations and a few big donations from the guys who have had the most success, and it's a very doable project. And this is where it belongs. You know, 100,000 Vietnamese Americans and growing, right? As the population grows with children, with births, and you know, the Vietnamese community, much like the Italian American community when my grandfather came here, and they had numbers like that, will become and is becoming a permanent fixture here. And one of the greatest efforts in the history of Western civilization was the great sacrifices of that war. It's not what we're doing today, but it's something that we should never forget. You know, over 200,000 men, women, and children in Vietnam who put themselves, you know, out there and made the sacrifice for democracy and freedom. It's something most, really, all other Americans here, other than those who have fought overseas recently, have never had to do. You know, we've really not had to do that. So it's a great reminder about the price of democracy and freedom. And of course, there are 58,000 American soldiers who were casualties in that war. So what better place to do that than here? So that'll be another agenda. It's a different kind of project. It's not going to provide health care, but it will provide, I think, a sense of deeper community here.
Great. And thank you so much again for being with NetV today. And hopefully in the future, if you have any project, that we're going to be here and then we try to spread out the words for you. In closing, do you have any words that you want to talk to the viewers? You can feel free to do so.
Well, I do want to thank the Vietnamese community, especially for the great support that I've received politically. I just get up every morning, try to help people, so I don't know why I really deserve the support that I get, but it's been very overwhelming support over the years, and I just want to let people know that I very much love what I'm doing. I enjoy my job, and I enjoy working for you. So thank you for your support.
And again, this is the time is up. And again, thank you so much for being here with NetV today. And we just want to say goodbye to the audience, and you're having a wonderful day.
Thank you.